A very good evening and welcome to this special evening planned in association with Public Health Foundation of India to talk about the scope of public health career for doctors. So the field of public health mainly focuses on disease prevention and overall improvement in patients' life after and before contracting any disease. With proper implementation of public health measures and improvement in the new medical care system, the life expectancy of people has increased. And according to WHO data published in 2020, life expectancy in India is 69.5 for males and 72.2 for females. Improving the health of individuals and society for supporting healthy lifestyles, preventing injuries and diseases, and controlling infectious diseases requires stringent strategies and programs designed to train individuals for careers in public health. And to help here with this session, we have with us Dr. Sanjay Zodpey. Welcome, sir. He's the Vice President of Academics in Public Health Foundation of India. Dr. Sanjay Zodpey holds a leadership position as Director at the Indian Institute of Public Health, Delhi. He is also an honorary adjunct professor at 5 international universities. And in addition to that, he is an adjunct faculty at the Faculty of Biological Sciences, Academy of Scientific and Innovative Research, CSIR, Government of India, and honorary distinguished professor of Health Systems, Department of Medical Research and Development. He's a physician, epidemiologist, scientist, and a thought leader on public health, positioning him to drive the global public health agenda. He's also involved in several major national and international research initiatives in the field of public health. It's a pleasure to host you today, sir. Welcome to Dr. Plexus.
Thank you, Dasika. May I now share the screen?
Yes, sir, sure.
Yeah.
Yeah.
Thank you, Dashika, for a generous introduction and this opportunity to speak in this session on looking at the career opportunities for medical graduates in the context of public health. And I'm also informed that some of the dental graduates also have joined today's session. So I will focus mostly on providing you understanding of what kind of career opportunities are available in the public health for the graduates, but looking at both medical graduates, but also the dental graduates. Let me begin this talk by saying that a tale of two excitements. We all are graduates, and what happens is that when you get an admission into a medical school or dental school, that is the first excitement that happens in the life after lots of hard work in the 12th standard that you get into a medical school. And the second excitement comes when you graduate as a medical graduate or a dental graduate after a lot of hard work in the education, in undergraduate education, that you acquired MBBS degree or the dental degree or the physiotherapy. Then the question comes that after that, what next? That you have acquired MBBS degree or the dental degree. And the question comes, which is $1 million question, is that what do I next? Obviously, one of the choice that most of the medical graduates or dental graduates would think about is enrolling for a postgraduate program. That after MBBS, that you want to prepare for your entrance examination to get into a PG program, whether it's a, and you would have your own choice of whether you wanted to pursue in the MD programs or the surgical programs, as the MS programs or MDS programs. Or otherwise, you start thinking about where do I find a job in the health sector after my MBBS, whether I should join health services or whether I should join some private sector and find a job for yourself. But also looking at what are the other options. But my advice at this point in time would be pursue your goal, pursue your own dream. That what do you think that you wanted to do after medical graduation or the dental graduation, and see that how do we fulfill that dream. But in that context, let's do some reality check. In India, currently we have 600 plus medical schools. And if you look at the undergraduate capacity of these institutions, is close to 91,000 or so. And around 7,000 to 12,000, this number is quite variable. It has dropped down because of COVID in recent years. Students also go for the medical degree outside India. So from that perspective, if you look at, it's close to 1 lakh seats, total seats available for medical programs, including those around 12,000 range is there, around maybe 8 to 10,000 students who go abroad for uh, education, and they come back as foreign medical graduates, and they of course have to clear the examination before they join medical services in India. So a lack of undergraduate seats. And if you look at the number of postgraduate programs in India, it's 493 medical schools offers PG programs, and total number of seats are close to 41,000 or something like that. And if you also add DNB and the College of Physicians and Surgeons seats, which number is quite variable, then maybe that 6 to 8, 9, 10,000. So that translates to 50,000. So for calculation purposes, let us understand that there are 100,000 undergraduate seats available and 50,000 postgraduate seats are available. Why I'm saying these numbers is important to understand that. Therefore, every year, if you see you have undergraduate seats of a lakh or so and 50,000 only the postgraduate seats, it means that every year the 50,000 MBBS graduates will not get admission to a PG program in medicine. And of course, some students would continue to go for multiple attempts, and therefore, these numbers will continue to increase. And in effect, it's a total accumulation is even 50,000 plus several numbers, several thousands more, who would be interested in pursuing post graduation, but they wouldn't get PG seat in medical school. And also wanted to mention this 50,000 postgraduate seats which are available also includes diploma programs, and some of you may not be interested in pursuing diploma programs. Some of these seats also include non-clinical like anatomy, physiology, biochemistry, these programs, paraclinical like for example pathology or microbiology. So those kind of seats also are included, and someone might be only interested in clinical programs. So the point I'm making here is that as compared to the undergraduate seats, the postgraduate seats available to pursue the postgraduate programs is almost 50% or so, and the numbers are increasing over a period of time because of repeated attempts the students would be trying to get into. So the question then is that not getting through PG entrance examination, and as I mentioned, sometimes someone may be interested only to pursue clinical postgraduate programs in medicine, surgery, or ophthalmology, or pediatrics, or orthopedics, and so. Uh, Although with repeated attempts, also at times frustration because seats are limited, competition is very high, and so that would always be there. And sometimes then the students get frustrated also, and then what do you do, and what can I do is the question comes into mind. Of course, those who pursue, they may be happy, they may not happy, but of course they get through the postgraduate program. And but one needs to understand that considering the competition, considering the availability seats, it's not the end of the career. That even if you have done your MBBS, it's not that something that you would be seeing that I haven't got through. There are other options available. For example, one can go for the general practice, and one can look at as on the basis of MBBS degree or dental degree, getting into a general practice. You would be interested in joining the health services on the basis of MBBS as a medical officer in public sector, even in armed forces. You can also look at organized private sector with some additional qualifications in industrial health or pharmaceuticals you might be interested in joining. Uh, Several students these days also think of civil services. And civil services, I mean, not only looking at the UPSC services, but even the State Public Service Commission provides a lot of administrative jobs, and any graduate can do that. And therefore, MBBS graduates are also eligible to do that. And we find several MBBS graduates, even my students in medical schools, getting into the civil services, even Indian Foreign Services and revenue services and other public service commission opportunities. One can also, after MBBS, pursue PhD program, and that is possible in some of the institutions in India. After MBBS, you can enroll for the PhD program. One can think of entrepreneurship also, like getting into NGO sector, and these days, a lot of opportunities where one can think of startups and new initiatives in that context. But I wanted to emphasize that there is an exciting opportunity to build a career in public health. If you are interested in clinical program, you get into that, that's fine. But if you do not, if you are not finding place into the postgraduate program, you can still think of public health as a career. And I would present you the case and how do you build a career in public health, and how public health field provides you a wonderful opportunity to build your career. If you look at the health workforce, because we all work in health sector, so health workforce includes doctor, nurses, public health professionals, pharmacists, dentists, paramedical workers, we call them allied health professionals, then frontline workers like ASHA, as you know, the other health workers and support staff. So this is the composition of the health workforce. Public health professionals, both medical background and trained in public health, or non-medical background and then subsequently trained in public health, forms an important part of the health workforce. And there are several positions available and several opportunities available for the public health professionals to work into the health system. But to tell you briefly, and I'm sure that because several of you are MBBS graduates and even dental graduates, and because you studied the community medicine or public health dentistry, but I'm presenting these two definitions of public health. And why I'm presenting these two definitions of public health, to tell you the much more broader scope of public health. Let's look at the first one, that was 1920. The Winslow had told us is about the science and art of preventing disease, prolonging life, and promoting health and efficiency through organized community effort. So broad definition. Preventing disease, so many things that one needs to do for prevention of diseases, prolonging life, promoting health. There's so many interventions that are involved here. The another one, which was presented 10 years back in 2010 as a part of the recent broadening of the public health understanding, is that what we as a society do collectively to assure conditions in which people can be healthy. Now we can see that this definition is so broad, which requires very diverse and transdisciplinary approaches and workflows. And we'll come to that, but these two definitions tells us that we need a very broader understanding of public health, and we need a variety of the people to work in the public health from that perspective. So this transdisciplinary nature that these two definitions tells us about the public health, and the approaches that we would use find applications to the public health professionals in wider sectors. Therefore, the scope of the public health, as it's seen from these two definitions, is changing and expanding over a period of time, providing several opportunities to the public sector that we're going to talk to you today. But then who is a public health professional then, therefore, against the background of understanding what public health is all about? A public health professional is a person who is educated in public health or a related discipline, who is employed to improve the health through a population focus. Somebody may have a nutrition background working in public health, or the statistics or the management background in public health also forms into the larger arena of public health professionals. And therefore, all these that I am going to present to you are public health professionals. You are MD community medicine, or you have done MPH, you are the public health specialist, public health administrators, epidemiologists, entomologists, public health engineers, health communication specialists, anthropologists, occupational health specialists, program managers, monitoring and evaluation specialists, veterinary physicians getting into the public health, data management, health journalists, occupational health nursing, community dentistry, public health lawyers, public health microbiologists, town planners to trade experts, with all qualifications can work into the public health. Including biostatisticians and nutritionists, that which I presented to you. Now, you talk about smart cities, and how do you, without better public health understanding, can be a better town planner or trade experts, the implications of the trade on the human health. veterinary physicians getting into the public health is important, with One Health, zoonotic infections, public health geneticist, molecular biologist. So there are several opportunities to work into the public health in variety of the domains that one can think about. And therefore, public health can be considered a discovered discipline, because it is not the person's initial profession, but a choice that we embrace later on. Like, for example, you are an MBBS graduate, then you get into a public health, or you may be a nutrition person getting into the public health, or you have a background in management and then you wanted to work in public health, or if you are a statistics and then you want to work in public health, even anthropologist, economist, then you wanted to get into the public health and become a health economist. So it basically is providing a lot of opportunities, and that's the beauty of public health, that it's so multidisciplinary, and therefore it is considered as fusion of several disciplines as such. But then looking at what kind of programs are available if you wanted to get into the public health. If you wanted to work into the public health, after your MBBS program, you can join MD in community medicine, or diploma in public health, or diploma in community medicine, or even community health administration, tropical medicine, health administration. So all these are the programs. Even MHA, like Master of Hospital Administration, some of the medical schools offer this program only for medical graduates, but now it is open for even non-medical graduates also. Even diploma programs are offered through medical schools. Then these days, several institutions in India have started offering Masters in Public Health program. It's a 2-year degree program, and several institutions, both in public sector and private sector, offer Masters in Public Health, where a lot of opportunities are available to work into the public health. But if you wanted to do some specialized program, then you have programs in epidemiology, like applied epidemiology program, or health administration and management, several programs independently as MHA programs, but even MBA in health management and administration, hospital management and administration. So these kind of programs are also available and provides opportunity to work into the public health. Some programs are a combination of health and hospital management and administration. Government of India in 2008 or so launched a public health management program. Is a 1-year diploma program, and several state governments can nominate, have been nominating candidates for this particular program. So there is a variety of the programs. Even occupational health also, if you wanted to work as an industrial physician, then one can do the program related to the occupational health, health promotion, and so on. So there are several programs that one can look at it after MBBS or BDS, or even other graduate programs that one can explore the possibility into. And I also wanted to say, because many times the question is that you have programs and you have many opportunities to get into the programs, but what kind of requirement is there in India? We looked at the requirement, and I looked at some international requirements also. Like, for example, what Brazil has recommended is 100 public health professionals per 100,000 population. So that's 1 per 1,000 population is the recommendation of the Brazil. Association of Schools of Public Health in United States tells us that one should have 220 public health professionals per 100,000 population. We calculate like doctors or nursing per 100,000 population. Similarly, this is what is the requirement per 100,000 population. But unfortunately, if you look at in India, where one of my students had done some work and estimated the public health professionals working in India, we found that only 11 public health professionals per 100,000 population. So even if you go by the Brazil baseline that would be required, then we would require minimum 10 times. Or if you follow the ASPH guideline, then we would require 20 times than the public health professionals currently are existing in India. So the need is there. And unfortunately, there are no standard norms, but if you use the ASPH norm, that 220 per 100,000 population, and considering the India's population, that would translate to maybe around 27 lakh public health professionals that would be required. Of course, these numbers are huge, and I would say that probably these many positions would not be available, but we are talking about the need, and we will have to see that how it matches the demand. The point I'm making is that all these recommendations tells us that we need more public health professionals, people trained in public health, to work in this country. COVID-19 had made us realize that unless we have people trained in public health working in India, we will not be able to improve our health system and deal with the challenges that we are confronted with this time in COVID-19, but subsequently other pandemics too. And then, but what are the career opportunities? This is a number again, but where are these numbers coming from? These numbers are coming from either you can join teaching and training institution, research, policy and programs, and practice. These are the major domains that one can look for the jobs. Then sector-wise, both in public and private sector. In public sector, the health, the union and state health departments, women and child welfare, defense, railways, public sector undertakings also for that matter, environment, food and agricultural, urban development, rural development. These are the various departments and ministries where you would find positions. In private sector, there is quite significant increase in number of opportunities in NGO sector, then hospital that I mentioned to you, then corporate sector. These days, even the consulting firms have been recruiting graduates trained in public health, then industry, pharmaceuticals, then this contract research organizations, site monitoring organizations, even IT industry, insurance. Health insurance is going to be an important role. So if you do some program in the context of health economics also, you would find job related to health insurance, media and journalism. And there are several CSR initiatives coming up. Then international organizations like World, a variety of the organizations, the foundations, development sector provides several opportunities. But also in the context of subject area, like you can be an epidemiologist, so these are the subject areas. You can be a biostatistician or data manager. There are big data analysis opportunities coming up. You can be a demographer. If you do a program in health management and you become a health manager, hospital manager. Climate change and environmental health is going to be an important area. So cross-cutting into the environment, climate change and public health, you can specialize in environmental health, occupational health, as I mentioned, like an industrial medical officer and other responsibility, social and behavioral sciences, social scientists working the health sector, health economist, health financing, nutrition. Veterinary public health is very important, one of the areas, and again, COVID-19 has re-emphasized the need of this important area in the context of One Health, entomology, public health engineering, health promotion, communication, journalism, even public health laws for that matter. Then disease-specific expertise. You work after your MPH program, you work in the vector-borne disease controls program, or you work in the CTD, the Central TB Division. You would find a lot of our public health graduates working as consultants in the Central TB Division through some organizations, including World Health Organization and other organizations, placed there working as a consultant. Public health laboratory, health policy, ethics, monitoring and evaluation is also one of the areas which is very promising coming up in next few years. Then several job opportunities are coming up in global health, oral health, family health. So this is based on the domain-specific areas that one can look at it. Some emerging areas like pharmaceuticals. After your graduation in public health, you can get job in pharmaceuticals, medical insurance that I talked about, medical tourism is coming up, wellness. Then clinical research is one of the emerging areas where public health graduates can work into corporate hospitals, and then health technology, consulting firms. These consulting firms like Boston Consulting Firm and McKinsey and PricewaterhouseCoopers and so on, they are into the health sector these days, and they are involved and they are doing a lot of work in the health sector. And if they wanted to work in the health sector, they need understanding of the health sector, and therefore they continue to hire graduates trained in public health to work with them. So that's the another area that one can think about. Clinical research and health insurance, these are the two areas that I already mentioned, but are emerging in terms of clinical operations, pharmacovigilance, medical writing, data management. Even you can make a career in grants writing, scientific writing, health insurance, non-life insurance companies, life insurance companies, specialist health insurance companies, and this is going to increase over the period of time. Then certain niche areas, like for example, now you would have heard recently there is a controversy in India about the estimate that are generated in the context of mortality related to the COVID-19. So that is the expertise in disease modeling. Our country needs expertise in disease modeling. We realized during COVID-19 that there are very few people or few institutions who have this capacity of undertaking disease modeling. We should not be dependent on researchers in outside India. We should have our own capacity building in these areas, systematic review and meta-analysis, advanced statistical analysis, big data analytics, using GIS for public health, economic analysis, policy analysis, grant citing. These are the areas where we need to see that how do we build the capacity within the country. And there, public health specialists specializing in disease modeling or specializes in conducting meta-analysis, systematic reviews, secondary reviews can play an important role. After your MPH program or any public health program, you can also explore the possibility of entrepreneurship. You can create your own NGO for that matter, providing healthcare into rural, tribal, or urban health areas. You can set up preventive care setups. I know several of our students or friends and colleagues who have established their own NGOs and doing very good work in public health. So some of them have set up preventive care setups like non-communicable diseases or sex and marriage counseling clinics and so on. You can also do some consultancy kind of a work in public health. That also provides the opportunity. I just picked up the example of public health nutrition for that matter. Few years back, one of our colleague has done some estimate of how many public health nutritionists would be required, and she estimated more than 22,000 public health nutrition experts would be required. Similar estimates are available for occupational health physicians or epidemiologists or health manager or hospital manager. Our national health policy, which was released 5 years back in 2017, has clearly articulated the need of public health management cadre and strongly recommended multidisciplinary public health management cadre to be created by the states. And therefore, in next few years or so, we expect there will be more positions being created in the public sector on the recommendation of the national health policy in 2017. But recently, few days back only, I would say it's 2 weeks back only, there is a new, the guidance for this implementation and rolling out of the public health management cadre booklet has been released by the government of India. And this was earlier endorsed in 2019 by the Central Council also. But now this is one step further forward to push the creation of cadre, and not only the public health management cadre. This has emphasized multiple cadres like the teaching cadre, then cadre for the specialists and clinicians, and the public health cadre and public health management cadre. So I think these milestones will create more jobs for the public health professionals in the coming years. That's what I believe. We also looked at and we did the analysis of employability of public health graduates in India. We did the mapping of public health jobs in India. Where are public health graduates placed? Also looking at what kind of opportunities are available and the employer's perspective of what kind of skills and competencies are required to work into the public health. But the point I'm making is that there is a sky limit. The sky is the limit to work in the public health. There's huge opportunities coming up. It takes time, obviously. It never happens overnight. But for the good students and who are sincere and do a serious 2-year program, have a tremendous opportunity to work into the public health. Building career in public health is not only important from the personal professional growth point of view, but it is also important for the national contribution. We all should be proud to go work in the public health, is that we actually contribute to the national development, societal development, because our beneficiaries in public health are nameless and faceless. We work for the community. We work for the people. The work that we do is is benefiting to several millions of the people, and that immense satisfaction that you would get when you work into the public health is important. And those who would like to work in public health will help us to create Swasth Bharat along with Swachh Bharat. So therefore, I would strongly encourage those who are interested in public health that they should look at the opportunity. And there are a variety of the programs, and many institutions now, both in public and private sector, offer programs in public health. We at Public Health Foundation of India, we have established 5 Indian institutes of public health: Delhi, Gandhinagar, Hyderabad, Bhubaneswar, and Shillong, and we also have a center in Bangalore. And all our institutions offer variety of the programs in public health, both on-campus mode and also e-learning mode. And you can visit our website if you wanted to learn about more programs. But beyond PHFI, there are many other institutions and universities which also offer programs in public health, and you can explore those programs to see that what is the best for you and think of creating and building career in public health. So thank you for this opportunity.
Thank you so much, sir. Very well defined, and I think a lot of us did have some confusions regarding, the job opportunities. So there are a couple of questions we would like you to take up. Will that be okay?
Sure.
Okay. So we've received two questions from Dr. Ronald. So he says the scope of public health dentistry jobs in India, teaching jobs are very almost non-existent. And what would you like to throw some light on the opportunities in India for the same?
Yeah, of course, the teaching jobs are available only in dental schools for after your MDS in community dentistry or the public health dentistry. But looking at largely the oral health perspective, I would say that public health dentistry, oral health, cancers, and a lot of tobacco, like for example, uh, a lot of NGOs working in related to uh, no tobacco initiatives or prevention and control of tobacco use. Uh, so those initiatives and those NGOs provide opportunities for public health dental graduates. The other is even non-communicable diseases, because cancers for that matter, oral cancer is one of the areas, but tobacco another is one of the areas, smoking. So, so NGOs working in non-communicable diseases also provide the opportunity for this public health dental graduates to work into.
Thank you. Moving ahead to my next question. So, why MBBS or BDS students go for public health? First question, and what are the risks and rewards in public health?
Yeah, I would say that I presented a simple arithmetic that one thing is that there are undergraduate 1 lakh seats and only 50,000 seats are available for postgraduate. So at any given point in time, there will be 50,000 students, undergraduate students, who will not get into the post graduation. And that's the reality of the life. And one way is that only MBBS, and then you look for other opportunities, which I have already mentioned. Another way of looking into is that you still can contribute to the health sector by doing MPH. So I would strongly urge, if you are not getting into clinical or other, MD programs or MS programs, then you do your MPH program. And there are many institutions now, or even hospital management and other programs that which I mentioned, that one can look at and pursue, and that will provide you a better career opportunity than a plain MBBS graduate. If you're a plain MBBS graduate, you can still do a general practice and you work as a medical officer. But if you are in health system working as a medical officer, MBBS, then maybe you would be promoted after many, many years into a senior position working into the health system. But if you have MPH qualification, then you can climb the ladder in the health system also. You can become a district health officer and deputy director and joint director. Several of our students are working in leadership positions in public health who have acquired MPH qualifications or a postgraduate diploma in public health management. And therefore, that is rewarding. I don't see any risk to work in public health. Is always rewarding. There cannot be any risk for that matter. Nothing is going to happen if you do your MPH program. But the more important is that, see, qualification is one thing. Having qualification and then subsequently experience. To work in public health, you need passion. You need passion to work in public health. That is more
Right.
important. So once you have passion to work, aptitude to work into the public health, then you can do wonders into the public health. So don't think that there are any risk involved in jobs and pursue. I don't see any risk in working into the public health.
So that I think a question which I think most of the graduates would want to ask is about the salary. So, what is the salary a good MBBS plus MPH graduate can expect when he or she begins to work?
Yes, salaries are variable, and of course, and they are depending on, like, for example, suppose somebody who is MBBS, 3 to 5 years experience, and then doing MPH. So that experience also counts. That person will have a higher salary as compared to a fresh MBBS student enrolling for a MPH program. So experience also matters, number one. Number two is that during MPH program also, which institution, good quality institution, there is a mushrooming of institutions. So it depends which institution that you are passing out MPH graduation, so the quality of the program. Third is that the competency that you have acquired, because finally you are selected through a very competitive process and you will be assessed for your competencies, knowledge and skills. So these all variables would definitely decide and define the salary. But I would say that our MPH graduates currently are getting salary, fresh graduates also, in the range of around 40,000 to 50,000. Now, there may be some graduates with some experience would get 55,000, 60,000 at the beginning itself. There will be some graduates, maybe in some programs, sometimes to begin with, the salary may be 35,000, 38,000. But you just, get into and jump that. COVID-19 has reduced certain opportunities because a lot of NGOs, they could not recruit because of their financial situation. But now it is again coming up. And I would say that you should consider around 45, 50,000 is the average salary that the MPH graduates would get.
Okay. So also, I think you did talk about like salaries do variate in terms of your experience, but also the place you're working. So I would want to understand what are the possibilities for positions in WHO, in international like associations, UNICEF, UNDP, after doing an MPH.
So there are opportunities, but they also look at some experience for that matter. So you may start your career in NGO or something, gain an experience, and then you can join into the program consultants. And now these days, WHO does not mean only sitting in Delhi or Geneva. It means also working into the rural area. Even at the WHO has some positions at a district level. Like for example, polio surveillance program, or even tuberculosis and vector-borne disease control programs, where you would find positions being created at a district or divisional or regional level. And that is also possible. Even the World Health Organization is recruiting BDS graduates with MPH qualification, not only the MBBS graduates with MPH qualification. So there is a tremendous opportunity for even BDS graduates to work as a surveillance medical officer after doing MPH. Otherwise, they would not get. But after MPH qualification, they can get into the WHO. Similarly, in UNICEF also, you rise basically. You start at district level and then you look for. So as a consultant, opportunities are there. Then regular jobs are also available subsequently that one can climb up to.
Okay. So also, I think as a part of teaching, I would say how we actually this pandemic definitely has taught us a lot about the healthcare systems. So do you think the jobs for public health would now sort of expand, or rather, because you did mention that NGOs and governments did not really had the funding, and which is why they had to cut down on positions. But now I think after the pandemic has almost got over or is in control, will public health jobs now expand?
Certainly, basically, I mentioned because during that COVID 2 years or so, because there's a lot of strain on financials of the NGO sector, but definitely there is already increase that we have seen, and things are getting towards normalized. Our current batches of MPH students, we have our placement colleagues tells us that a lot of openings are coming up. And you mentioned about teaching positions also. So what happens is that if you are MD in community medicine, then you can directly get into the medical schools, or even in public health schools as a faculty. But for MPH graduate, you can start as a tutor or a teaching assistant kind of a thing, but then you have to look for a PhD program, and you do a PhD in some specific domain of public health, and then can explore the possibility of you are interested as a faculty in schools of public health or these management institutions. Then it is better that you look for a PhD program. Then you do a PhD, and then you subsequently join as a faculty.
Okay, but sir, like you did mention about some good institutions for public health which we have in India. I would want to know whether this MPH, like this degree, is in India recognized in foreign countries as well.
Yeah, MPH degree, because MPH degree that is offered by in India is UGC recognized, institutions as a University Grants Commission or institutions of national importance. Is recognized everywhere, but the countries have their own mechanisms to recognize the degrees also. Suppose some African country, they will have their own mechanism to recognize the Indian degree. Like India also recognizes degrees of other countries, and they have their own equivalence being decided. But MPH done in India, which is approved by the UGC, is recognized everywhere. You can enroll for a PhD program based on our MPH to other universities also.
Okay. So I think one last question. So can one do an MPH after MD in clinical subjects also?
Yeah, of course, you see, in getting into the public health, there is no age bar and there is no profession bar for that matter. And we have seen a lot of people having getting into the public health, not only doing degree into the public health, working in the public health. Professor Vinod Paul works, and because you must be knowing him quite well, everybody these days. He's a pediatrician. He's a pediatrician. He was a professor of pediatrics, but most of his work, later part of his life, is into public health. Professor Srinath Reddy, who is the president of Public Health Foundation of India, is a cardiologist.
Yes.
But the last 20 years, or I would say 25, 30 years, he has been working into the public health. Professor N.K. Arora, you would find many clinicians, they may not have, some of them have acquired, even Professor Reddy has qualification in epidemiology also, and as Professor Arora. But the point I'm making is that several clinicians, either acquiring some qualification and they get into the public health, or some of them even without acquiring public health qualifications, formal qualification, I would say, work into the public health. And that's very much possible, and we would welcome that combination of clinical understanding and public health would really contribute and help public health advancement.
Sure. So I think these are all the questions that I had for today. But would you have any closing remarks or any comment for our audience who are watching us live here?
No, I would only say, to work in the public health, you need a passion, number one. Number two is that I wanted to say, if you have a passion and if you come into the public health, there are tremendous opportunities to work into the public health. Everywhere, hard work is important, and you need to be street smart. You need to acquire those competencies which are critical to work into the public health. But there are very emerging opportunities, not only in India, in global health also, and you can have a bright career into the public health. So I wish, and I would welcome each and everyone who is participating here today to join public health, because it's not only your profession, but that's how we contribute to the society, and that's how we contribute to the national development also. And we need bright, young people to join public health, to advance the public health. There's tremendous scope to work in India, and we all need to join hands to see that how we improve the population health for our own people.
All right. Thank you so much, sir. And with this, I would like to close today's session. So, dear viewers, if you have any more questions, please do drop them, and we'll make sure that Dr. Zodpey gets these questions, and he'll be helping us with the answers. If you have any queries, do reach out to us. And with this, I would like to thank everybody for joining today. Thank you so much, Dr. Zodpey, for your clinical insights, and as well as this entire, I think it was a much motivation lecture which was required for our physicians as well. So thank you so much for joining, and have a great evening ahead. Thank you so much.
Thank you, Darshika. Thank you.